Thank you, Mr. Acting Speaker, to the Honourable MEC for Health. With regard to security at the Sharp Clinic, Johannesburg Academic Hospital, the MEC please indicate what is the name of the company that presently operates the security cameras at this hospital? 2, how much is this company owned by the department? 3, how many security cameras are there at this hospital? 4, how many of these cameras are presently operational? And 5, what is the reason why any of these cameras are not fully operational?
Honourable MEC Papo.
With regard to security at Charlotte Maxeke, Johannesburg Academic Hospital, the name of the company that presently operates the security cameras at this hospital is Caucus Security and Cleaning Services CC. How much is this company owned by the department? 4.9 million. How many security cameras are there at this hospital? There are 547 cameras installed at the institution. How many of these cameras are presently operational? 352 cameras are fully operational. What is the reason why any of these cameras are not fully operational? The cameras are not fully operational due to non-payment by the department. However, the department is engaged in discussions with the company and agreed on the payment of the outstanding amount. The company has in turn agreed to reinstate maintenance of the security system and ensure that the system is fully operational. In effecting that agreement, the company is currently working on repairing the system, which is anticipated to be fully functional by the 14th of December 2012, which will include the payment of the 4.1 million.
Thank you, Honourable MEC. Honourable Bloom, your supplementary question.
Thank you, Mr. Acting Speaker. So we see that just under 200 security cameras at this leading hospital are presently not operational, and 4.1 million rands outstanding to this company. The Honourable MEC has taken decisive steps, but I think it's very distressing that this has gone on for so long. As a follow-up, I want to ask the Honourable MEC, for how long have these cameras been not operational? I know that you're doing your very, very best. So mid-December, all these cameras will be operational. But for how long were these cameras not operational, and what would it be the effect on security at this hospital? We already have a very high theft rate, and I'm just wondering how many items were filched because these cameras weren't working. Thank you.
Honourable MEC.
It has been an on and off matter in terms of payment, but as I indicated, these discussions we've entered with and having a payment agreement. So I would say that in the last 4 or 5 months, I'm not definite, but it has been on and off because of this problem of payment and not having a payment agreement with the company. But as you say, some of the cameras were working. There have been some measures the hospital took to ensure that at least in some of those areas where the cameras were not functioning, the mobile security actually moves in, because there's management of security and also guarding services. So there has been an agreement. The issue of theft in our facility is a bigger issue which we have to address. And as you know, there are a number of cases in the department where people are charged for theft of various items in the hospital facilities. It's an issue which we have to address with employees of the Department of Health, because anyone who steals in a health facility, and it's been historical, this problem. We used to have TPA sheets in townships and suburbs. People stealing TPA sheets, hospital bed sheets, and pillows and mattresses, in fact. People who still live in food. So it's a bigger issue which we are trying to address. It has to be addressed formally with organized labor. It has to be addressed at a facility level. And that does not only affect general workers, also includes people who are in middle management and some of the people who are in other levels. It's a bigger problem, but we are addressing it and we're actually nipping it in the bud. The level of of theft has gone down in some of the facilities.
Thank you very much, Honorable